When you notice a rash or changes in your skin, it can be hard to know what's causing it. Psoriasis and lupus are two autoimmune diseases that can look a lot alike, but they have important differences. Knowing what to watch for can help you get the right diagnosis and treatment. Both psoriasis and lupus are autoimmune diseases, which means the body's immune system attacks its own tissues. They can cause skin symptoms and sometimes even joint pain or nail changes. But each condition affects people differently, and they don't always look the same from person to person. Psoriasis is more common than lupus in the US. It affects about 8 million adults, while lupus affects around 1.5 million. Psoriasis happens equally in men and women, and most often in non-Hispanic white people. Lupus is much more common in women. It's usually diagnosed in people between ages 15 and 44, especially those with African American, Hispanic, or Asian backgrounds. Psoriasis usually causes thick, dry, scaly patches on the skin. These can be red, brown, or purple, depending on your skin tone, and often have a silvery scale. Psoriasis can also show up as small spots, smooth red areas in skin folds, or pus-filled bumps. It may even affect your nails, making them thick or pitted. Lupus often causes rashes on areas exposed to the sun. The most classic sign is a butterfly-shaped rash across the nose and cheeks, called a malar rash. Other lupus rashes can look a lot like psoriasis, with red or scaly patches, but they usually don't itch as much. Both conditions can cause joint pain and nail changes, and their rashes can look very similar. But lupus rashes often show up on sun-exposed skin and may come and go based on sun exposure or disease activity. Psoriasis rashes can appear almost anywhere, often itch more, and usually have that telltale silvery scale. A dermatologist is the specialist who can tell the difference between these conditions. They may do a physical exam, run blood tests, or take a tiny skin sample called a biopsy. Getting the right diagnosis is important because treatments can be different for each condition. Psoriasis and lupus are treated with some of the same medicines, like steroid creams. But some treatments for one condition can make the other worse. For example, a medication used for lupus might trigger psoriasis symptoms, and light therapy for psoriasis can make lupus rashes worse. That's why it's so important to work with your doctor and keep track of your symptoms. If you notice a new rash, joint pain, or changes to your nails, don't wait. Talk to your doctor. Early diagnosis and the right treatment can help you manage symptoms and protect your health. Learn more and connect at mypsoriasisteam.com.